someone after surgery asked me to autograph their breast that I did.
Oh.
That was a little out there. And then getting to your story, I had a new patient, a consultation, and she was waiting in the exam room, and I knocked and walked in, and they'd given her a gown, but she was standing totally naked in high heels, just sort of.
Oh my gosh.
I think I said, I better get 2 chaperones for this one. So I had another one that came in with a fur coat, and she was in the fur coat.
How many of these stories do you have?
Well, now
I had one, he had 2. You're like, wait a minute.
Maybe I intentionally tried to forget about this.
I think it gets back to your field of plastic surgery. In the emergency department, I think it may happen more because it's, honestly, getting back to calling it inappropriate behavior, from my standpoint, it's because it is such it's a stressful environment. And I think as a doctor, you're trying to create
a loving, caring environment.
Yes,
good bedside
a compassionate environment where you're safe. And when you're a patient, that can be just a very stressful time. And I think, you know, you may even say things you normally wouldn't say because you're out of your element, and all of those things can get misconstrued, and I think that's the biggest thing.
It happens, but the thing is, it really is a big deal. They've had studies, and this has been an issue for decades, and some physicians, especially female physicians, will sometimes stop offering certain examinations. They may change their work hours. Maybe they won't work after hours and things like that. So they're essentially changing the scope of their practice, and they're limiting what they can offer patients because they are put in these uncomfortable situations. So it really can have a profound impact on someone's career.
Here's when it's the most difficult is, if I may, it's also, there are certain times, take an emergency department where there's one physician staffing it, and smaller ERs, this will be the scenario. Well, the great thing about medicine is if a patient comes in and requests a treating physician of a certain sex, almost always, if it's a big enough hospital, you can honor that request. Usually there will be, if it's a big enough emergency department, that you can honor the request. Maybe a female asking for a female physician, a male asking for a male physician.
When it comes to a rectal exam, I don't discriminate. It's okay.
Well, you've done it on the show. But you're
I've
different.
done it on the show with both men and women. But, you know, to your point, there are certain patients that say, oh, I want to be the last patient. I want to be the end of the day. And that's sort of a red flag. I mean, there's little things you can look for that a patient potentially could be a problem in terms of, call it sexual harassment, or just seeking inappropriate behavior.
That's a plastic surgeon's
thing.
Probably reality in some cases.
The lowest incidence was among pediatricians, OB-GYNs, and radiologists. But I bet if they did this study with nurses or medical assistants, the numbers would be way higher. Because you think about it, they're giving them baths, and I mean, just the opportunity just presents itself time and time again. And I think that's very unfortunate and something that definitely needs to be addressed, because you want everybody to feel comfortable in the work environment, and you want patients to get the care that they need and deserve.
Absolutely.
Yeah.
And the most important thing when you're feeling ill is to get the care that you need. And certainly, I wonder if there will become a day, though, in a time when every patient interaction is recorded in some way.
I'm sure.
Who knows? But
I mean, I know some doctors have videotaped consultations now just to make sure that certain things were said and certain things weren't said.